In the vast landscape of modern healthcare, the role of artificial intelligence, AI, has emerged as a transformative force, promising to reshape the way we diagnose, treat, and manage medical conditions. Navigating the AI frontier, before we embark on this exploration, it is crucial to understand the essence of AI in healthcare and its potential implications. AI, in its simplest form, refers to the development of computer systems capable of performing tasks that typically require human intelligence. These tasks range from language translation to problem solving, and in the healthcare context, they extend to diagnosing diseases, analyzing medical images, and even aiding in drug discovery. A glimpse into the future, the impact of AI on healthcare is not confined to the realm of science fiction. It is happening now, at this very moment, in clinics, laboratories, and hospitals worldwide. AI is empowering healthcare professionals, researchers, and patients, ushering in a new era where data-driven decisions and personalized treatment plans are the norm. Defining the future of healthcare. Before we dive deeper into the realm of artificial intelligence, AI, in healthcare, let's lay the foundation by understanding what AI is and how it functions within the medical landscape. Understanding AI, at its core, AI refers to the development of computer systems that possess the ability to perform tasks typically requiring human intelligence. In healthcare, AI serves as a bridge between data and actionable insights, revolutionizing the way we approach medical challenges. Here are some of the primary types of AI utilized in healthcare. Machine learning algorithms, a subset of AI, have the capacity to learn from data, identify patterns, and make predictions. In healthcare, this translates into more accurate disease diagnosis, personalized treatment recommendations, and early detection of health issues. Natural language processing, NLP, enables machines to understand and interpret human language. In healthcare, NLP can be used for tasks like medical transcription, extracting insights from clinical notes, and even assisting in doctor-patient communication. Computer vision algorithms empower machines to interpret and analyze visual information. This plays a pivotal role in medical imaging, aiding in the diagnosis of conditions through the analysis of X-rays, MRIs, and CT scans with remarkable precision. Robotics, AI-driven robots are making their mark in healthcare by assisting in surgeries, conducting repetitive tasks in laboratories, and providing physical therapy to patients. Their precision and reliability are enhancing healthcare delivery. Real-world application. As we embark on our journey through the world of AI in healthcare, it's essential to recognize the tangible impact it has already made. AI-driven diagnostic tools, for instance, can analyze medical images, such as mammograms or pathology slides, and flag potential abnormalities with an accuracy that rivals or surpasses human experts. Furthermore, predictive analytics powered by AI can forecast disease outbreaks, helping healthcare organizations allocate resources more efficiently and save lives. In our quest to comprehend the influence of AI on healthcare, we will uncover a tapestry of applications, each contributing to the evolution of medicine. From AI-powered chatbots assisting with patient inquiries to drug discovery accelerated by machine learning algorithms, the landscape of healthcare is being redefined. Pioneering the future of medicine, the integration of artificial intelligence, AI, into healthcare isn't just a technological advancement, it's a paradigm shift with far-reaching benefits that touch every aspect of the medical ecosystem. In this section, we'll explore the remarkable advantages that AI brings to healthcare, reshaping the landscape for patients, practitioners, and researchers alike. Improved accuracy and efficiency. One of the foremost benefits of AI in healthcare is its ability to enhance accuracy and efficiency in diagnostics and treatment planning. Machine learning algorithms can analyze vast datasets with incredible speed and precision, reducing the margin of error in medical decision-making. For example, AI-driven diagnostic tools can identify anomalies in medical images, such as CT scans, X-rays, or MRIs, with a level of accuracy that surpasses human capabilities. This means faster and more accurate diagnoses, ultimately leading to improved patient outcomes. Personalized care. AI's capacity to process vast amounts of patient data, including medical records, genetic information, and lifestyle data, enables the tailoring of treatment plans to individual patients. Personalized medicine, made possible by AI, allows healthcare providers to design therapies that are not only more effective but also have fewer side effects. By considering an individual's unique genetic makeup and medical history, AI can recommend treatments that are specifically suited to their needs, fostering a new era of patient-centric care. Cost savings. Efficiency improvements brought about by AI can lead to significant cost savings in healthcare. For instance, AI can optimize hospital operations by predicting patient admission rates and allocating staff and resources accordingly. Additionally, the early detection of diseases through AI-driven screening tools can result in more cost-effective treatments and better long-term outcomes. By streamlining administrative tasks and reducing errors, AI can alleviate the financial burden on healthcare systems. Real-world impact. The benefits of AI in healthcare are not confined to theory, they are being realized in real-world scenarios. Cancer diagnosis. AI-powered tools are aiding oncologists in detecting cancerous lesions and tumors in medical images, enabling earlier and more accurate cancer diagnoses. Drug discovery. AI algorithms are accelerating drug discovery processes by analyzing vast datasets of chemical compounds and predicting potential drug candidates, shortening the time it takes to bring life-saving drugs to market. Remote monitoring. AI-driven wearable devices can monitor patients' vital signs and alert healthcare providers to potential health issues, allowing for early intervention and improved chronic disease management. As we journey deeper into the realm of AI in healthcare, we will also address the challenges and limitations that must be navigated to fully harness its potential. From data privacy concerns to regulatory oversight, the path to AI-driven healthcare is not without its obstacles. Nonetheless, the promise of a healthcare landscape marked by greater accuracy, personalization, and cost-effectiveness is too compelling to ignore. Navigating the complex terrain, while artificial intelligence, AI, in healthcare holds immense promise, it is essential to acknowledge the hurdles and limitations that accompany this transformative technology. Part 2, we discuss challenges and constraints within the healthcare landscape. Subscribe. Thanks.